Hello friends, this is Dr. Rohit from Hair Clinic and Rohit Productions. Well, a lot of my patients always ask me regarding the proper use of a toothbrush, how to brush their teeth. The most frequent and the most asked question by me to my patients is, how do you brush your teeth? Well, a lot of my patients always give me the same answer regarding the use of a toothbrush and a toothpaste. But how do you brush your teeth is the basic question. So for that, I have uploaded this video, and I'll be uploading a video later where I'll be discussing about the various types of toothbrushing techniques in detail. So for that, first we'll understand the basics of toothbrushing. Let me just have a toothbrush in my hand, giving back the toothbrush holder to the stand. So when I have a toothbrush in my hand, the first thing I need to know is this is the basic handle and these are the bristles. So the various techniques for toothbrushing depends on how do I place the bristles and how do I make the movements of toothbrushing. For that, let me just have upper and the lower teeth in my hand. When I have the upper and the lower teeth in my hand, okay, this is why I have the upper and the lower teeth in my hand. So the basic thing I need to know is that how do I make the movements? Okay, the way I make movements give me the various techniques. There are various movements which I can make with the toothbrush, using a toothbrush when I'm cleaning my teeth. Okay, so whenever I start with, suppose I start with the posterior and the distalmost teeth, where I keep my bristles on the gums, where I'm making a to and fro motion with a vibratory technique. This is the vibratory technique, where I'm rolling it around the tooth. This is the rolling technique. Sweeping it would be around, sweeping around the teeth. Circular movements would be making small circles with the toothbrush bristles. Vertical would be making a vertical, keeping it perpendicular to the teeth and making an up and down motion. And the various gum placements, various bristle placements on the gum and the teeth, that determines the technique. Sometimes I can place the bristles on a 45-degree angle obliquely to the tooth and the gingiva and make movements. Or I can place the bristles coronally between the gums and the interdental space and then move it upwards, clearing the interdental cleaning. Where I can place it perpendicular and make the movements where it can irritate the gingiva and cause bleeding sometimes. Where I can make the circulatory movements, circular movements, and do the cleaning. Or I can do some motions like keeping the bristles on the gum and the teeth, and then moving in along lines, doing the intercircular cleaning and then interdental cleaning too. So for this I have a very basic chart which will tell us how to do the bristle placement and how to do the brushing. So this is a chart we'll be dealing with. We'll be talking about the various bristle placements, where we have the first technique is the scrub technique, then we have the bath technique, then the modified Stillman technique, then we have the roll technique, the Stillman technique, the charters technique, and then the phones technique. So the way you place your bristles, the way you make the movements makes and determines the technique you're using. So this is a very basic chart we have, a very basic thing we need to know about the toothbrushing techniques. So the toothbrushing techniques are classified according to the type of brushing movements you make. For the rolling strokes, for the rolling motion you make, you have the techniques called as the rolling stroke or the modified Stillman technique. If you make circular strokes, we call it the phones technique. If you make vibratory strokes, we call it the charters technique or the Stillman's technique or the bars technique. We normally employ a vibratory motion in that technique. Where we are using a vertical technique, we call it a Leonard's technique. Where we're using a horizontal, we call it a scrub. Where we're using a physiologic technique, we call it a Smith technique, where we follow the physiologic contour of the teeth. So we just follow the physiology of the teeth, the way the teeth are formed. This is the technique which is called as the Smith technique. So these are various techniques we used for toothbrushing. So I'll be discussing each technique one by one in my later videos. So thank you for watching the very basic video regarding the toothbrushing technique which depends on the bristle placement and the way you move your toothbrush. And keep watching my videos. We'll be discussing every technique in detail. Thank you for watching this video. This is Dr. Rohit signing off from Dental Clinic and Rohit Productions, and have a great day. Thank you.